Welcome to Health and Harmony Beyond the Teeth, where we dive into all subjects that will help you become healthier and happier. As a dentist, I believe dentistry is more than just teeth, so I created this show to focus on overall health. We will hear from leading experts about eating better, exercising better, breathing better, and sleeping better. We want to help you create harmony in your life so you can live your life to the fullest. We want you to thrive. Welcome to Health and Harmony Beyond the Teeth. I'm Dr. Stewart, your host. I'm a dentist, but I do much more than that. I'm the founder and CEO of the Stewart Center for Optimal Health in Flower Mound, Texas, where we help people become healthy by helping them breathe better and sleep better and give them optimal oral health. And we do that by growing beautiful faces. Health is much more than just teeth to a dentist. The teeth and the gums have so much to do with, and the size of the jaws have so much to do with airway, with just total thriving and living for our patients. Today I'm very pleased and honored to have Dr. Matt Barker with me today. Dr. Barker is a thinker, kind of outside the box, kind of like I am when it comes to medicine. He's a doctor of osteopathic medicine, and he practices in Southlake, Texas. So, Matt, welcome.
Thank you. Thank you for having me on.
You bet. You bet. So, Dr. Barker is my doctor. I've been seeing him now for about a year. What is exactly, for our viewers, what is a doctor of osteopathic medicine? What's your training like?
So there are two different types of fully licensed physicians to practice medicine in the United States. Your Doctor of Osteopathic Medicine, or DO, and your medical doctor, or MD. And so either one can go into any specialty such as surgery, family medicine, pediatrics. The main difference in our training as a DO is we learn everything that MDs learn as far as Western medicine goes in medical school. And in addition to that, we learn how to use our hands to diagnose and treat a lot of different problems. And the techniques that we learn, we call osteopathic manipulative treatment.
Okay.
So really, we do everything they do, and we learn an extra tool.
Okay. And so as a doctor of osteopathic medicine, then you have a couple of subspecialties?
I do. So after medical school, you can choose to have different specialties. My two areas of focus are osteopathic neuromusculoskeletal medicine. And so with that, I'm a specialist in diagnosing and treating any kind of musculoskeletal, neurologic, or rheumatologic condition. And my other area of training is in family medicine. I do more functional integrative medicine. So whether I'm treating pain or chronic disease, I'm trying to get to the root cause of the problem and treat it in the most natural way possible.
And that's, I think our philosophies really coincide with each other in that, because that's always been my philosophy, is finding the root of the problem and going there instead of just treating a symptom. So if Mr. Smith wakes up in the morning and his back is out, or he's got this horrible muscle pain in his back, traditional Western medicine might say, okay, here's a prescription for muscle relaxers, stay off your feet for 3 or 4 days and see me back next week. How would that differ on, and I know this is just a very broad category, but just in a broad sense, not specifically, but you would approach that how? Something like that.
So I would assess the patient, and for that particular case, low back pain, very common scenario is that the patient may actually have one leg that is slightly shorter than the other leg. And so, for example, my right leg is 7 millimeters shorter than my left leg. And I started having low back pain when I was, 13, 14. And I would get these low back pain episodes. I'd throw it out every few months. I'd have to get treated. But it kept coming back. And it wasn't until I started residency and my program director actually pointed out, hey, your right leg is shorter, which I confirmed with x-ray, started wearing a little lift inside my shoe. And now I rarely have had low back pain in the last 5-6 years.
Yeah.
And so now when I do get treated, the treatments are holding, instead of before I would get treated, and as soon as I was up on my feet walking around, it just caused everything to go back out of balance. So that's a good example of looking for, why is that back pain starting?
Yeah. Well, a lot of people might go for a back pain or neck pain or shoulder pain. They might go to a chiropractor, and I'm not bashing chiropractors at all, but there is a difference between what you do and what a chiropractor does. And there are many good reasons to go to a chiropractor, but tell us the difference between what you do and what a chiropractor generally does.
Sure. So I grew up going to chiropractors myself and was originally planning on going into chiropractic medicine myself. Chiropractic, osteopathic manipulative treatment, massage, physical therapy, those all kind of fall under the general umbrella term of bodywork. So any health practitioner that is treating another patient with their hands are body workers. And so we all have a little bit of different terminology. Most other body workers use one or two different treatment modalities. And so chiropractors are most commonly known for spinal adjustment or, popping your neck or your back. Massage therapists are known more for the muscle techniques and soft tissue stuff. And so within osteopathic medicine, we learn the spinal adjustments, we learn techniques to treat the fascia, the ligaments, the muscles, the organs, the cranial bones, the lymphatic system. So it's a very comprehensive treatment of the whole body. And as a specialist in my field, we learn how to use those techniques on everything from newborn babies to toddlers to pregnant women during and after pregnancy, athletes, older adults, and even hospitalized patients. So we would get consulted to treat patients in the hospital to help them get out of the hospital faster. And so, for example, like a cardiothoracic surgeon would consult us to come and treat their patients after a major surgery while they're in the ICU and have, chest tubes coming out of the side of their chest. So we're knowledgeable enough to safely treat any patient for a lot of different conditions.
So doing body work on a patient, let's say that's had cardiac thoracic surgery, that would enhance their healing.
Correct.
Maybe relieve discomfort.
Correct. So there's been a lot of studies done for hospital-related conditions, and some of the conditions that osteopathic manipulative treatment has been shown to be effective for would be like pneumonia, preventing or treating something called post-op ileus, where their bowel function doesn't return after surgery. And so a lot of the surgeons would start consulting us after their cases to help them to progress out of the hospital faster. If someone was in the hospital and just happened to have neck pain or back pain pre-existing, the hospital beds aren't going to do any favors for that. So we would also help them just to be more comfortable, decrease their need for pain medications while in the hospital, and just support their overall care.
Right. And as I've said, Matt, many times on this podcast, the body is the best pharmacy that we have. And too often we ignore that and we don't let the body do what it needs to do. That's what I love about what you do, is that you're giving the body the best chance.
Yeah, I like to
heal
say
itself.
We try to remove the barriers that are stopping the body from doing what's supposed to. Because when we cut ourselves or break a bone, the body wants to patch all that up and heal it. But sometimes it needs a little bit of help. And so that's where I come in and try to remove those obstacles that are stopping the body from healing.
Yeah. And I know some people are medically compromised for different reasons. And so, not everybody can just be free of all medications. But so you do use medications in some cases. I mean, I know from patients that you've treated.
Correct.
My patients, but that's not your first order of treatment. It's just to get out the script and write a prescription.
Yeah, so it's very specific to the patient. So depending on what the patient's coming in, osteopathic manipulative treatment may be the first step. A musculoskeletal injection may be the first step. A medication may be the first step, or all three of them in the same day may be indicated. So it's really customized to the patient. And what I like, why I chose the training I did, was because it afforded me the greatest variety of tools in my tool belt. So I have the hammer and the screwdriver and the sander and the chisel, all of those things to really customize to the patient's need and not try to make one thing fit everybody.
Right. Well, and that's, we're all different. We're all the same. We're all the same in the sense that our bodies, given a chance, will heal and do much better than if we're just automatically throwing a medication, which then every medication has a side effect.
And some of them have a lot.
And some of them have a lot of side effects. And so when you take a medication, then you have to realize there's side effects. Really the only side effect of letting the body heal itself is that the body will heal itself.
Correct. Yeah.
It's a good side effect. That's the effect that you want.
Some patients, they'll be on medications and then those will cause side effects, and then their doctor will put them on another medication to treat that side effect, and it just
compounds.
Adds on, and you get patients with these medication lists that they're basically a walking pharmacy.
Right. Oh, I know. We treat more and more complicated cases since we've gotten into the craniofacial development and airway in our practice, and some of the medications. Well, even when I was just doing regular general dentistry, the list of medications people come with, it really is, it's scary. And it's, one of the goals that we have for our patients, this is kind of a secondary goal. The goal is to get them as healthy as possible. But a secondary goal is to try to get them off those medications.
Yeah, well,
and having a talk with their physician.
Yeah, and the two things go hand in hand. As you become more healthy, you have less need for medication.
Exactly. And no side effects. It's cheaper. The chemicals your body produces naturally are much cheaper than the ones that the pharmaceutical companies.
Right.
What is your feeling? And this can be a whole other podcast. And Dr. Barker is going to be a semi-regular guest on our show. So this is just kind of a broad overview, but what are just in general, what is your thoughts on vaccinations? That's a big buzzword now.
Yeah, man, put me on the spot. So I think that overall vaccinations have done a lot more good than harm. One thing I wish that there was a little bit more transparency around the antibiotics and the vaccinations.
Yeah.
For example, in medical school, for every medication and drug that we learn about, we have to learn about how it works, what it's used for, the dosing, and the side effects.
Yeah.
And when we learned about vaccinations, we learned how they work, when to give them, and that they were, good for everybody, pretty much. Mm-hmm. And so there are potential for adverse outcomes. And so I think as doctors, we should be better educated on what those are, so that when it happens and the patient comes in thinking that it's from the vaccine, that they're not getting kind of blown off.
Right.
And and then the other thing is, some of those potential adverse outcomes could be from toxicities in the body, or a patient's inability to detox after vaccinations, or from other outside toxins, heavy metals. And so having doctors be better educated on how to detox the body properly and how to assess someone's ability or inability to detox, and that can really go a long way.
Yeah. Speaking of detoxification, this is interesting because that there's more and more people that are doing that. I mean, there's so many chemicals now. I mean, we've started wiping down our kitchen, our stainless steel cookware, with just warm water, and we have these special rags that we do instead of spraying a stainless steel cleaner on there. Because if you look at those ingredients, there's, most of you can't even pronounce. Do you offer a detoxification regime?
I do.
And treatment with your patients?
Actually, I just went through a detox myself, and I did a toxicity test that tests for heavy metals, mold toxicities, and environmental toxins. And interestingly, I had 2 moderate elevations in mold toxicities, and then 3 high and 3 moderates in the environmental toxins. So those are ones coming from pesticides, plastics, other chemicals. And of note, 2 of my high elevated ones are known to be associated with infertility issues, which my wife and I had issues due to my problem. And so we had to do IVF to have our daughter, and thankfully it worked. But that was something that, was a huge impact for us.
Yeah.
And so I went through a preliminary kind of 21-day detox program just recently. I felt great on it. I actually lost some weight. That wasn't my main purpose of doing it, but that was a side effect or byproduct. And I retested just the environmental toxin piece of that test. And already just in 21 days, it was better. 2 of my abnormals that were in the moderate level went back into normal, and the remaining 4 all got better, significantly improved. So I still have some detoxing to go to finish my own self, but it is something that we can check for. There's lab testing to monitor whether you need detoxing, and then to monitor the efficacy of the treatment plan that we put together.
Oh, that's great. I think that really should be a standard of care, that any physician should at least offer that to patients, because there's so many chemicals in everything we do now. They're in the air and the water.
Yeah, you can't really 100% avoid it. And so I plan to do that 21-day detox protocol once or twice a year, just to clean up, because you're just never going to be perfect.
Yeah, so once you detox, you're not going to stay that way. No matter how healthy you try to eat, you can reduce the amount of toxicity, but you're never going to get away from it completely.
Right. I mean, we're living in a very chemical-driven world, so you just can't be 100%.
Right. So, Dr. Barker, we talked about bodywork earlier, and we're actually going to have a series of podcasts with you talking about bodywork for infants and children and adults as well. I know in our practice we are starting to treat infant tongue ties surgically. Dr. Corridor has taken a residency program to learn the surgical procedures for that. So in talking with you in the past, I know, and a lot of people don't think about this, but when a child is born and they come to that birthing canal, a lot of things can get messed up with their bones and things like that. So just briefly, because we are going to do this as another podcast, but why is bodywork important for a week-old infant?
So all babies are born with some muscle tightness, and they did a study looking at restrictions in the head, neck, and lumbar spine in day 2 to 3 old babies, and in each of those categories, like 90% of the babies had restrictions or asymmetries in those areas. And that's just due to being stuck in a small space for 9 months and then coming through an even smaller space, during the birth process.
Right.
And so that can lead, those small traumas can lead to pain, restricted range of motion, can affect the nursing, can affect their gastrointestinal health. A good example, I treated a 6-month-old, and the baby was unable to turn his head one way, and after I was done treating him, he could turn his head both ways, no problem. And I talked to the parents a few weeks later, and they said, we thought that our baby would startle and cry to loud noises, and that he was scared of the loud noise. But after you fixed his neck, we realized he wasn't crying because of the loud noise. He would cry because he would turn to look at the loud noise, and it was hurting his neck.
Oh,
so something like that, this 6-month-old baby, they can't tell you, hey, Dad, my neck hurts.
Right.
And so usually if it's just some muscle tightness, 1 or 2 treatments in a newborn, it takes care of that.
Mm-hmm.
And then there's certain conditions that they may have that require a few more treatments, but it's usually not a forever thing. We treat them a couple times to address the problems during their infancy, and then I recommend parents bring them back when they're like walking, and then after that once a year, unless something comes up.
Okay. Yeah, that's interesting. A lot of parents with infants that are seeking traditional medical cures for different ailments, a lot of these things could just be from the alignment being out and a negative neuromuscular response.
Correct.
From that. And that's what I love about osteopathic medicine, is that it's going to look at what's going on, functionally with the body first, before we're just going to, write an anti-inflammatory prescription or or something like that. I'm
Yeah.
sure there's times where that's proper and indicated, but oftentimes that doesn't need to happen, a prescription.
Yeah, and to be honest, people I think readily think of chiropractors or osteopathic doctors when it comes to musculoskeletal problems like back pain or neck pain, but less often do they think of osteopathic medicine as an option for organ-related dysfunctions, but it can help a lot of those things too, like constipation, heartburn, ear infection. So often I can treat a child with an ear infection and they don't need the antibiotic.
Right.
And if they end up needing the antibiotic, well, I can do that too. Moms with acute mastitis, we can treat that. A lot of like pneumonia or other upper respiratory infections, sinus infections, often those kinds of things we can clear up and not have to resort to the antibiotics if we get to them early enough and work with them.
Talk a little bit about the physical effect of I'm going to call them, for lack of better words, emotional disorders or emotional trauma or stress in someone's life. Those emotional things, they have a physiological manifestation.
For sure.
Correct?
So if you think of like a triangle, and at the top here you have your mental health, here you have your organ health, and here you have your musculoskeletal system. Dysfunction in any one of those three categories can cause dysfunctions in the other two.
Yeah.
And so if you have depression, it's been shown that that's going to correlate with more pain and more musculoskeletal complaints, and vice versa. If you have chronic pain for a structural reason, that's going to make depression and anxiety more likely as well.
And it's a vicious cycle then at that point.
Because then they're both feeding into each other. Same thing with the organ-related health. And so once I started addressing more the organ component of all of the dysfunction, I noticed I was getting better results with my back pain and my neck pain. For example, if you have dysfunction of the heart organ, then it will actually send a feedback loop through the nerves that control the heart from the sympathetic. So the nerves along the spine from T1, thoracic 1 to T4. Those innervate the heart, and so the heart will actually send signals back to the spine, and the muscles along the spine at that level can actually become more tight and rigid. And so when you're feeling somebody with back pain and they have tightness in that area, it may be a clue that there's something going on at the organ level that spine part of the spine innervates. Yeah,
the body everything's connected.
For sure.
It's all connected. And I think insurance has kind of compartmentalized everything. But I know that my youngest daughter was born with a heart defect, and it wasn't just her heart affected, but the lungs, because that all works together. People with congestive heart failure have fluid buildup in the lungs because the heart is part of keeping the lungs free from fluids. And so it's like that over the whole body. I always use the analogy, it's kind of like if your wheels of your car are slightly out of alignment, then the tires start wearing more. And as the tires start wearing more, then the car can vibrate. And then as that vibration increases, it's not efficient, so it uses more gasoline. And then your dashboard starts getting creaky and and you start getting noises there, and before you know it, you get a crack in your dashboard, and this just happens slowly over a period of time. And when I think about what you do in going back to body work, is that you're taking this machine, which we are, a biological machine, and you're basically fine-tuning it with your patients. But some patients are a lot further away from the fine-tuning than other patients are, right?
Yeah, well, and that I actually, a lot of times when I'm done treating somebody, I'll say, all right, all tuned up. So, yeah, I like your analogy.
Yeah, for a while. I mean, you know, we expect our bodies to just perform perfectly all the time, but we can buy $100,000 Mercedes in 5 years when it needs new brakes or a tune-up. That doesn't surprise us at all.
Yeah.
But our bodies need that.
Well, yeah, and my goal for my patients is for them to get the maximum amount of benefit while seeing me as little as possible. So my goal, I don't want patients to have to come in every week or even every 2 weeks.
Yeah.
I think for something acute, they may need a few appointments close together, and then that problem may be totally resolved.
Right.
If we're treating something chronic, then it may be that they're coming in to some frequency, and that may be once a month or once every 3 or 4 months. It kind of just depends. But my goal is for people to not need me, but when they do need me, I want them to come in.
Right. And I know that you've set up a concierge plan for your patients where they can pay a monthly fee that covers a lot of different
Correct. Yeah. So
services.
Since I have 2 different specialties, the business model is slightly different. So if somebody were to come to me just for osteopathic manipulative treatment, or I'm treating their neck or back pain, but they have their primary care taken care of elsewhere, then it's just fee for service. They get a super bill that they can submit to their insurance after, and I don't dive into their primary care stuff.
Yeah.
But for patients who want me to look into their gut health or manage their medications or help them with weight loss, something that's more on the primary care side, I do a monthly membership model. And so that allows for a really good doctor-patient relationship.
Yeah.
Patients can call and text me directly or email me, so that you're not getting the back and forth of calling the office and not getting a call back, or having the doctor answer the wrong question through their office staff.
Yeah.
Longer appointment times. Basically, the monthly membership covers unlimited in-person or telemedicine visits to discuss medications, labs, supplements, wellness visits, or acute sick visits. And because there's no cost difference whether they come in person or have a remote visit, if a patient doesn't require an in-person visit for something that we're doing, most of them opt to do telemedicine. So I've been doing a lot of telemedicine even before, the current pandemic.
Right. So it's your personal health coach right here, Matt Barker. I mean, really, it's a coach is somebody that takes another person and helps them develop to be the best that they can be. And that's what Dr. Barker and other osteopathic doctors are doing. Matt, it's been great having you on today. It's awesome.
Yeah, I appreciate having.
We're going to have you back many more times because there's just too many subjects that we can cover in one podcast. But as we do at every episode of Health and Harmony Beyond the Teeth, we have our guests pick an excerpt of a song, and we're going to play it. Then we'll play it, then you can tell us who it is and what that song means to you.
Hey, I'm on vacation every single day, 'cause I love my occupation. Hey, I'm on vacation. If you don't like your life, then you should go and change it. Hey, I'm on vacation every single day, 'cause I love my occupation. Hey, I'm on vacation every single day, every single day. Every single day, every single day. Every single day, every single day.
I think that one kind of speaks for itself.
I know. I don't.
Do you love what you do, Dr. Barker?
I do, yeah. So it's kind of, I like that song because it's the motto I try to live by.
Yeah.
And I also love going on vacation, but I love going to work too. So I'm like excited for Monday morning and going and helping patients. And I got into this field because I was looking for answers for my own health.
Yeah.
And now I want to share those with other people.
That's great. Dr. Matt Barker, Doctor of Osteopathic Medicine in Southlake, Texas. His information is listed below. If you guys want to give him a call, and he's a great wealth of knowledge and an excellent doctor and a good friend. So thank you for being on today.
Thank you for having me.
This has been Health and Harmony Beyond the Teeth. Dr. Hal Stewart. We'll talk to you next time. In the meantime, stay safe and stay healthy.